Join Niniola Williams, Managing Director of Dr. Ameyo, Stella, Adadevoh, DRASA Health Trust on Inspiration 92.3 FM, Lagos, every Wednesday at 11:30 a.m. to 12 p.m. for the DRASA Half Hour. She'll be teaching practical tips on how to stay healthy and prevent infections in our homes and communities.
So, what makes me tick? Well, you tell me. Just tune in to Inspiration 92.3 FM, your number one family radio.
Alright, Lagos, it's still your number one family radio, Inspiration 92.3 FM. Good morning once again, and big shout out to everyone listening to us right now, wherever you're listening from. We're back today for another exciting episode of the DRASA Half Hour, a public health awareness program that features on Inspiration 92.3 FM every Wednesday from 11:30 to 12 noon. Now, if you're tuning in for the first time, we are glad to have you join us, because this is a show where we get to learn valuable health lessons and also win fantastic prizes during the quiz session. Once again, DRASA stands for Dr. Ameyo Stella Adadevoh, the courageous doctor who identified the first Ebola patient in Nigeria in 2014. But unfortunately, she later died after contracting the infection from the patient. Now, her actions saved the lives of millions of Nigerians. And DRASA Health Trust is a non-profit public health organization established in 2015 to continue her legacy of protecting the health of Nigerians. DRASA is constantly working to develop health champions like you and I, who can identify and prevent infectious diseases and also influence those around them to stay healthy. In the studio today, we have two members of the DRASA team, and like I said earlier, they have come with prizes, so stay tuned for a chance to win. Our first guest this morning is Christopher Aliu, who is a program manager at DRASA Health Trust. Yes, he's a public health practitioner with over 8 years of experience managing behavior change, health promotion, and infection prevention programs for vulnerable populations. Our second guest is Moyosore Odumesi, who is a project associate at DRASA Health Trust. She has experience in managing health projects and mobilizing communities to take actions to better improve their health. It's a pleasure to have both of you with us today. Welcome. Thank you. All right, so let me start with you, Christopher. From our conversation last week, we spoke about ways of preventing ourselves from falling sick. Now let's talk about the importance of vaccines in all of this. Vaccines, do they work and are they safe?
Thank you, Okiki. Good morning to our listeners out there. I'm excited to be in the studio again today. So as we all know, it's not possible for us to completely prevent sickness or to not be sick at all. But from what we have learned in the past few weeks, if we take charge of our health, if we take some steps, some very important steps, we can prevent ourselves, protect our loved ones from falling sick, even when germs enter into our body. And that's why I'm excited today to speak about vaccines and the role they play in protecting us from getting sick.
Yeah.
So, a lot of us might have heard about vaccination, especially recently when we had the COVID-19 pandemic.
Yes.
I'm sure that also we might have heard about immunization. You know, when we hear doctors and nurses ask our mothers to bring their newborn babies to take vaccines when they are born, and even at other times, after their birth. So, what is vaccination? Vaccination and immunization are similar, but they are not the same, and I'll explain in a short while. So vaccination simply means receiving a vaccine, which is an injection, and it is one way to protect us from getting sick, even before we come in contact with germs. Normally, our body has armies and soldiers that we know as antibodies, and these antibodies helps us and fight germs when they enter into our body. So vaccines work with these armies, this defense system, to make them stronger, to prevent us from getting sick, when particular germs enter our bodies. For example, a child that took a measles vaccine when he was a baby will not fall sick, when they meet their peers in school. One of their peers maybe probably sick from measles. When they meet and the peer maybe sneezes or coughs into his or her face or even touches them, they won't fall sick. And it is the influence of that vaccine that the child has taken. But when we talk about immunization, what does that mean? Immunization means immunity, and which is actually the goal of vaccination. When we take this vaccine injection, it makes the defense system in our body to become stronger and help us to fight germs when they enter into our body. Basically, this is what vaccines do. And immunization means that the body has attained that status when they are stronger. The defense soldiers in the body become stronger, and when germs enter our body, they prevent us from falling sick. So, like that child who has measles and then comes in contact with another child who has taken measles vaccine before and coughs or sneezes into their face, and that child doesn't fall sick from that. So that is the meaning of immunization. So let's give another example. For someone who has taken cholera vaccine and later in the future they come in contact with the germs that causes cholera, it will be like what we call in our local parlance udiji, because the vaccine will fight the cholera germ and we won't fall sick. So that is what it means to be immune. We take vaccines to become immunized or to be immune from germs, so they can't harm us. Now, why are vaccines important, and why should anyone care about taking vaccines? I'll give us a scenario. How many of us have seen children grow up blind and they were not born blind?
Yeah.
Yes, and you'd imagine people would think that this can only be caused by witchcraft, right? But this is not the case. Do we know that measles, which can simply be prevented by a vaccine, causes blindness and deafness? So this is why we need to talk about the importance of vaccine.
Yeah.
So number one importance of vaccine is that vaccine is a very cheap way to save lives. A report on measles from the Nigerian Center for Disease Control in January 2022 showed that we had about 254 confirmed cases of measles across Nigeria. Interestingly, 149 of these cases are people who have not taken measles vaccine before. Also, currently we have 389 confirmed cases of diphtheria across 6 states in Nigeria. Sadly, 62 of these 389 cases, 62 of them are dead. And 5 of these deaths are from Lagos here. But again, this diphtheria that we're talking about is a disease that can simply be prevented by vaccine. There's a vaccine for diphtheria. So, as scary as these numbers are, it could be worse, because from records from the World Health Organization, vaccines help to prevent 2 to 3 million deaths of children under the age of 5 every single year.
Wow.
I pray that none of us listening this morning will suffer the loss of any of their loved ones.
Amen.
I mean, from a disease that a vaccine can simply prevent. But we know, I know that we are Africans, we are Nigerians, we like to pray a lot, but prayer alone cannot do this. Sometimes we need to take concrete steps to make sure that we are not sick from disease that vaccine can easily prevent. So let's ensure that our newborn babies get all the necessary vaccines that they need when they are born. Secondly, another importance of vaccine is that it reduces economic and financial loss. And what do I mean? For a parent whose child begin to fall sick because they've contracted measles at some point, must have spent a lot of money having to take care of the child. The money they spend going about here and there, for diagnosis, for consultation, money they spend to transport themselves here and there to the hospital and back home. That is a lot of money, right? So, and some people, because they are taking care of their children, they can't even go to work. They lose time from work, from their businesses. So in that event, you are making less money and then you are spending more. And we know that, as is often said, time is money. So if we don't want to spend our work time from one hospital to another, if we don't want to spend the little money we are earning from our business and our jobs to take care of sicknesses to our loved ones, It's important that our children and all our loved ones are vaccinated. And thirdly, vaccine also helps families to be more productive. Let's just put it in simple terms. When we are sick, we cannot go to work, right? And let me give us an example. When we talk about productivity, there's an example of a deadly disease that causes serious permanent damage to children, and that is polio. Polio, as we know, is an infectious disease that affects the limbs, which is the arms and the legs of a child. And in some cases, they become paralyzed. In Nigeria, between 2005 and 2009, we had over 2,000 cases of polio. That's like 2,000 children and some adults who will want to live normal lives like every other person. For example, they want to go to school, they want to grow up and learn a trade or do any form of business, get married and also make family. But because of polio, some of these people are paralyzed today. We see them everywhere. We see them on the streets. We see them around us. Now, even though the world has declared Nigeria polio-free, the world is polio-free at some point, but up till this moment, we still have 2 countries that still record cases of polio. So this means that even when these infectious diseases are totally eradicated, they just don't go away. They always find a way to come back into our communities. So if we let our guards down, they can always find their way back. So we need to be on guard, and so to avoid serious outbreak, polio vaccines are still being given to children in hospitals today, and they are free.
All right. Thank you so much, Chris, for giving us those wonderful insights about how important vaccines are. I know some listeners are out there now and they're wondering, I know they have questions about some vaccines, especially the COVID-19 vaccines. So if you're tuned in this hour, it's the DRASA Half Hour show with our guests from Dr. Ameyo, Stella, Adadevoh, DRASA Health Trust. They're here to educate us about our health and still give away some prizes for you guys during the quiz session of the show. If you have questions regarding this topic or anything you've heard today, please send them via WhatsApp to us on 0817-313-6193. 0817-313-6193. If you have any questions about what we've been talking about today regarding vaccines or any questions in general about your health, you can send it to us on that WhatsApp number. Our guests have come with prizes for the quiz session today, Lagos, so stay tuned and get ready. So let's move over to you, Muyosore. Who can be given vaccines? Is it for everybody?
Yes, we've talked about the importance of vaccines, and to your question about who can be vaccinated, the answer is everyone can be given vaccines.
Interesting.
Babies, young children, and adults. We have vaccines for babies, and we have the ones for adults too. For example, the COVID-19 vaccine. And yes, I know some of us didn't take that one, and we'll talk about the reasons later. But how many of us adults have taken the hepatitis B vaccine? What about tuberculosis? Now, I'll talk about some of these diseases. There are actually a lot of diseases that vaccines can protect us from. But I will be mentioning just a few today. So for everyone listening out there, and to our nursing mothers too, please pay attention, because this is going to be very helpful to us later on, and of course during our quiz time today. And the number one disease is tuberculosis, popularly known as TB. TB is one sickness that can be prevented by a vaccine. And most of us might have heard of TB, or we might even know someone that is sick with TB. TB affects the lungs. It can even affect organs like the brain and can also lead to death. The vaccine for TB is called the BCG vaccine, and is given to babies as soon as possible after birth, usually within the first 2 days after delivery. So our mommies, expectant mommies and daddies in the house, please, let's take note of this. Young children and adults too, under the age of 35, can also take this BCG vaccine if they've never had tuberculosis before. It protects us from severe forms of TB, and we can be protected for the rest of our lives. We also have hepatitis B. It's a serious disease that affects our liver. It can cause liver cancer and eventually lead to death if it's not treated well. This hepatitis B virus can spread from one person to another by direct contact. I hope we all remember, as we were told in our previous episodes, that direct contact means when you come in contact with body fluids like our blood, semen, saliva or urine of an infected person. It is also important for us to know that hepatitis B virus can affect anybody. You know, they look face, both young children and adults. So it is good for babies, you know, young children and adults to also receive this vaccine. For newborns, they should actually have the first dose of this vaccine within the first 24 hours after birth.
Okay. And
this vaccine is usually given 3 times, so that we are well, you know, fortified and protected for life. Another disease that vaccine can prevent is measles. We all know measles to commonly affect children. You know, usually you see it in children, but adults can also have measles if they were not vaccinated as a child. I know a lot of us know measles, you know, with the rashes on the body, your body is hot, you're coughing, you have red eyes. Now, measles vaccine ensure that, you know, it also gives us like a long life, you know, protection for a lifetime. And it is given to babies when they are 6 months. But usually in Nigeria, you know, the baby is given the vaccine at 9 months, and that's the first dose. Then the second dose at 15 months. There's also yellow fever disease. Do we know that, you know, malaria is not the only sickness that mosquitoes spread? That, you know, yellow fever, mosquitoes also spread yellow fever by, you know, when they bite a person that is sick with the yellow fever, then they carry that yellow fever germ to another person that is not sick at all. And this yellow fever disease, you know, is called yellow fever because it causes our eyes and our skin to turn yellow. It also has other symptoms like headache, body pain, vomiting, and, you know, bleeding of the organs inside our body. But the good news is that there's also a vaccine for yellow fever, and anybody above 9 months can take this vaccine, just a single shot. You just take it once and you're protected for life. So please, if you have children under the age of 5, ensure that your children get vaccines. Even as adults, we should get vaccines so that, you know, I know we all want to enjoy our life. So let's make sure that we take vaccines that we are eligible to take for our own benefit.
All right. Thank you so much, Maria Sir, for letting us know how we can protect ourselves against those deadly diseases. And it's very important to also note that, you know, as an adult, we can still take vaccines. Because I've heard a lot of funny comments from some people saying, I'm a certain age, I can't take this vaccine. No, you can take vaccines as an adult, as Maria Sir has stated. I'm sure a lot of people have learned lessons from today's program so far. So listeners, if you have any questions, please send to us via WhatsApp on 0817-313-6193. 0817-313-6193. Our guests are here, Maurice and Chris, and they're ready to answer your questions shortly. So please stay tuned to your radio set because the quiz session is coming up and we have amazing prizes for you today. Okay, now back to you, Chris. We've talked about vaccines and the diseases they prevent, right? So why are people hesitant, to take vaccines, especially the COVID-19 vaccine? Please enlighten us.
Thank you very much. So far, we talked about the different diseases that and the types of vaccine that we can take to protect us from those diseases. And I'm sure every one of us will agree that vaccines actually protect people from diseases. Then you begin to wonder, why did many people refuse to take vaccines for a disease as dangerous as COVID-19?
Yeah.
The reason is very simple. It's because of the wrong beliefs and lies and the rumors, as we call Ameyo, that people were carrying about, during the COVID-19 pandemic. All those lies and misinformation actually prevented or slowed down some people from taking the vaccine. Many of us are students of the WhatsApp University. We read comments from them, we see pictures and videos, and we tend to believe all of those things, even when they are wrong. Some people that actually took COVID-19 vaccine took it under duress because some people, because they want to jackpot, so they just have to go and take it because immigration requires that you bring a certification that you have taken COVID-19 vaccine. Some other people took it because it was made mandatory in their workplaces. So I'm going to be speaking about a few of those misconceptions today.
Yeah. And
as we have seen from the WHO, delay in taking vaccine has been named among the top 10 threats to our health. So let's take a few of those myths and rumors. So number one thing that we hear people say is that COVID-19 vaccine is not real. Some people even suggested that it's an attempt for governments of the world to control people. Some people, and that's why you see people that refuse to practice the preventive measures like social distancing, wearing of nose mask, and the likes. The reality is that COVID-19 is real, and it's caused by the virus called SARS-CoV-2. And many people around the world, many countries lost lives to this. We are very blessed in Nigeria to not have suffered so much casualty from COVID-19, and I thank God that Nigeria has lived through that period. But the reality is that COVID-19 is real and it kills people. So some even say that the vaccines are not safe. Many people believe that vaccines are dangerous to our body because people believe that they don't know what the health people are putting into our body.
Yeah.
And then some even believe that the vaccine can actually give people the COVID-19. It's not true. The reality is that it actually strengthens our immune system and helps us to fight this virus in case it gets into our body. And number 3, some people believe that COVID-19 only affects old people. I know that old people are vulnerable to severe symptoms of COVID-19. They can really be sick from it. But the truth is that both children, young adults, and old people are vulnerable to COVID-19. And also for people that have underlying health conditions like asthma and diabetes, they can really get sick from this COVID-19. So, Moyo, please, are there more you want to add to this?
Yes, so I've definitely heard of a few myself. Some people saying that the vaccine is like a mark of the 666 end time sign. Some people saying that the vaccines contain chips that government will use to monitor and track our lives and control our brains. The thing is, the truth actually is that vaccines they contain ingredients that will help us and strengthen our immune system to fight this virus, as we've talked about before. And another thing is that people believe that vaccines are too expensive. Please, this is not true. Because, most vaccines, especially for the routine immunization program in Nigeria, they are free in government hospitals, our primary healthcare centers around us, the BCG vaccine, those, the pentavalent ones, measles, whooping cough, diphtheria, hepatitis B, they are all free. And sometimes we even have these health officials, doing a vaccine campaign, coming to our, communities, and they will tell you to come out and take vaccine. Please, they are free. Take them. They are not expensive. Yes. So let's take vaccines. They protect us from, various forms of disease, like we've talked about earlier.
All right. Thank you very much, DRASA team, for sharing so much with us today. Over to you, to those who are listening to us. The phone lines are now open, so you can call us. The number to call is 0700 923 923 923 is the number to call. 0700 923 923 923. This is how it's going to work. We have 8 questions, and you can pick any number between number 1 and 8 to answer just one question. But note that if we ask a question and the caller gets it wrong, the next caller will have to pick another number to answer another question, because no questions will be repeated, and we're looking for only 3 winners. We're only looking for 3 winners. All right. If you have any questions, send them on WhatsApp on 0817 313 6193. That is 0817 313 6193. Hello. Hello. Hey.
Village
Please do try and call us back. 0700 923 923 923 is the number to call to win yourself some some prizes from the DRASA Half Hour. 0700 923 923 923 is the number to call. Hello, good morning.
Hello, good morning.
Welcome to the show. What's your name and where are you calling from?
My name is Irene from Ikotu.
Irene from Ikotu. Irene, are you ready for your question?
Yes, I am.
All right, Irene, pick a number between 1 and 8.
Okay. 5.
Number 5.
Okay, question number 5 says, list 2 benefits of vaccines.
Benefit of vaccine.
Yes.
Okay, it prevents someone from contracting diseases or germs.
Okay. That's interesting.
Okay, number 2, it also prevents one from falling sick.
That's still the same thing.
As number 1.
It's the same thing as number 1.
You can do
Can you
it.
try? Just.
Economic and financial loss.
Hey, we have a winner.
Thank you, Irene.
Thank you, Irene. Irene, send your name, number to our WhatsApp platform now. 0817 313 6193. Send your name and number to our WhatsApp platform now. All right, 0700 93 93 93. Let's see if we can still get 2 more winners. Hello.
Hello,
Good morning. What's your name and where are you calling from?
Patrick from Ikoto.
Patrick from Ikotun, welcome to the show, Patrick. All right, Patrick, are you ready for your question?
Yeah.
All right, pick a number between 1 and 8. Number 5 has been taken.
Say number 3.
Okay.
Number 3.
Hi, Patrick. Can you mention 3 myths or misconceptions about the COVID-19 vaccine?
Okay. Some say is a mark of the beast 666.
Okay.
Oh.
And some say is a chip to monitor the brain and everything about us.
All right.
And some say
You've got this, Patrick. You can do this.
some say
What they say? But
it's just fake. It's just fake.
oh, yeah, it's fake. Okay.
Okay, that is fake. That COVID-19 is not real. Oh, we have a winner again.
Congratulations.
Thank you.
Congratulations, Patrick. Patrick, send your name and number to our WhatsApp 0817-313-6193. Congratulations. Let me see. We have time to take one more caller. All right. Let me see. Hello.
Hello, good morning.
Hello. Good morning. Welcome to the show. What's your name and where are you calling us from?
I'm Joseph. I'm calling from Lekki.
Joseph from Lekki. All right, Joseph, are you ready for your question?
I think so, yeah.
All right. 1 to 8. Number 5 is gone. Number 3 is gone.
Okay, I think I'll go for number 6.
Number 6.
Okay, question number 6 says diphtheria is a vaccine preventable disease. True or false? This one a bonus.
Oh my God.
Diphtheria is a vaccine preventable disease. Is this true or false?
True.
Hey, we have
Correct.
a winner. Yeah, correct. That's correct.
All right. Thank you very much, Joseph. Congratulations. Please send your name and number to our WhatsApp 0817-313-6193. All right, Lagos. Thank you very, very much. We have got to go now. A big shout out to DRASA Health Trust for coming today to educate us on the importance of vaccines and immunizations. All right. We'll see you guys next week. But the world news comes up at 12 o'clock, and then at 12:15 Body Bruno comes with Sports Wakana at 12:30, and at 12:30
We'll make a return,
yes, on the media rewind. Yeah. All right, we have got to go. See you guys next week.
Join Niniola Williams, Managing Director of Dr. Ameyo, Stella, Adadevoh, DRASA Health Trust on Inspiration 92.3 FM, Lagos, every Wednesday at 11:30 a.m. to 12 p.m. for the DRASA Half Hour. She'll be teaching practical tips on how to stay healthy and prevent infections in our homes and communities.
Inspiration 92.3 FM.
It's 12 o'clock. 92.3, your number one family radio.
Always